Welcome to Life, bringing you insight and experiences into love, relationships, and fertility with a focus on enjoying life and moving forward. Today, we're going to be speaking about healthcare disparities in fertility treatment with Dr. Tia Jackson-Bey. Welcome to Life, Love, Insight, Fertility Experiences. I'm here today with Dr. Tia Jackson-Bey, who is a reproductive endocrinologist and fertility specialist at RMA in New York. And we're going to talk about diversity and disparity in fertility treatment in healthcare. Welcome, Dr. Jackson-Bey, and thank you for being here today.
Thank you so much for having me, Lori. I'm honored.
The pleasure is mine. You have done so much incredible work, and that's why I had to reach out to you and talk to you today. I find with the population that I work with, who is not white, there are different challenges that are faced when going through fertility that don't seem fair in many instances. And so I'm just putting that right out there to start the conversation, if that's okay.
Absolutely.
So how did you get involved in working in this and becoming, a spokesperson for it and making changes?
In the field of infertility, I've always been very intrigued with helping persons to build their families. I come from a very large family on both my mother and father's side, only one sibling, but both of my parents were one of many. And when I was pursuing medical school and realized that, some people had such trouble to build the families that they desired, that really just weighed on me. And I enjoyed the field so immensely. But along those lines, like many things in medical school, there are certain nuances to every single field. And one of the striking things for me was learning that, even within infertility, there are certain groups that still have a disadvantage. And why should that exist? IVF has been around for over 40 years. We have other treatments for infertility that have been around even longer. And so, for the most part, we have a good understanding of how to evaluate infertility, how to treat it, what options to offer. But even still, those options are not available to so many different populations. And so that's where I really started to get interested in health disparities, in understanding what drives them, what are the dividing lines, why do certain groups have different access and outcomes of infertility treatment.
Why do you think that is? I have a practice which is probably so tiny and so small when we look at the field of infertility, but yet even in my practice, I see it in play, and I see the struggles that go on. I see it a lot with donor conception. I see people coming to the table, so to speak, a little bit older. Mm-hmm. So what do you think it is that this dichotomy associated?
I don't think there's anything unique to infertility. This is a problem that plagues the American healthcare system.
Yes,
We've always had two different, parallel but unequal systems in this country. And so I think it's important for, anyone working in the infertility space to realize that we are not immune to that. This is a reflection, a mirror of a much larger issue and problem. So the same reasons why, women of color have higher rates of death and morbidity in childbirth are the same reasons why we see them later for infertility care, why they may have harder times navigating through the system to get the care that they need. Or it may be, less referred to even see us. And that plays into the reason why you may see women who are older or who've had a more advanced disease or who may be more resistant to proceeding with, donor conception and things like that. So I don't think that there are some things that are unique to our field in terms of, just the issues that we see, but it really is a reflection of the overall American healthcare landscape.
I'm so glad that you said that. What I find very often is that much of fertility treatment is parallel to what was going on prior to the fertility treatment.
Absolutely.
So if you've been having challenges navigating the system, you're going to have challenges navigating the system. And because there's so much going on, it may even be more so.
I agree with that. And I think that's something that is not really appreciated enough, even from providers in this space, is how much of yourself you have to give when you decide to pursue fertility treatment. There's a lot of new language. There can be a lot of expense because unfortunately infertility is not universally covered by health insurance.
Right.
There may be many visits, even in terms of diagnostics. We may need you to come in at different days during your cycle or more than one visit, or there are lots of different kind of components. And so for certain groups of people, working class men and women, that can be really difficult to navigate. How do you tell your job that you need multiple mornings off, or a later start, or unpredictable day off because you're during treatment, in order to kind of pursue this area of your life and your health? So I think that's something else that's pretty unique in the infertility space that we don't really recognize, is how much of a sacrifice it is for some people. And it really takes a lot of resolve, a lot of commitment, a lot of support, not just social support from the workplace, as I mentioned, from your partner or your social circle, from your insurance company.
I really say that it touches the biopsychosocial components of life. There's not a component it doesn't touch. And that's so hard. And, I love what you said, because it covers the gamut. And the fact that 1 in 8 experience infertility, almost 1 in 9, I almost want to say 1 in 9 all the time because the number leans more towards 9, but it's not there yet. It softens it. It makes it a bit easier these days. The fact that there are over 500 people advocating last week, and you were one of them, right, with Resolve, is
Absolutely
huge and tremendous. So I think we're starting to gain momentum. One of the things, though, that stands out to me dramatically, and I'm sorry to belabor if I'm belaboring this, but I really want people to know it, and I want people to start to feel comfortable having this conversation, is that when somebody of an African American or different descent goes to get a donor egg or donor sperm or donor embryo, or even adoption, things change. The supply isn't the same. And it becomes harder. And I've had people travel out of the country to be able to have a donor, and it's very expensive. And then when it's not available, it's very traumatic. So how do we help them? How do we help people understand that it's part of the process, it's part of the journey, but we want to make it better? And how do we get people of different nationalities to consider donating?
Yeah, I think that's, something that we all struggle with. We've talked a lot about this in the past, just about, it seems to be a social stigma, and whether that is real or perceived, there is still a barrier, a block, be it mental, be it social, be it financial, about proceeding with, donor conception.
And can I add one thing to that?
Absolutely.
People who are religious also have religion to face. Because
Absolutely.
the religious component, depending on what religion you are, plays a huge role in this. Some religions do not approve of
Agreed.
IVF or donor. Some of them will approve of IVF, not donor. I mean, it runs the gamut. And then sometimes it runs the gamut of the community in which you live. Now we get into secrecy and privacy. So the social stigma is huge with this.
Social stigma is huge. And that's why I'm also a huge proponent of including the community in these conversations. I have discussions with lots of different religious leaders about some of the nuances of not just a religion, right? Because there are different kind of fractions and rules based on maybe your different, what we call like a denomination or a sector or anything like that, or even the actual house of worship. The leader kind of may interpret things a little bit differently than a different leader under the same religion. And so engaging the community in that way is super important. They have to be part of the conversation so that you can understand how best to serve your patients. I don't think any religious leaders want to be strict. They want to see their parishioners happy and to build families. I mean, it's a huge part of, our human existence and human experience. But we try to find ways to work within the confines. And you'd be surprised that people need the education from providers, and then it helps to kind of shape what they have available to their parishioners as well.
Yeah, and what you just said though is so powerful. When I spoke with somebody from the Archdiocese, he was fabulous. He really was. And what he said is, it's not that the church necessarily doesn't want this, it's that the church is thousands of years old and they haven't caught up with the science. And so I use this example, and sometimes some people cringe with it, but he said, you can have a child through donor conception. It's not approved through the church necessarily, but if you go to confession, you're always taken back, and the child is always taken back into the church.
Right,
it's the conception. Right. It is the actual act of conception that the church looks at.
Wow. Okay.
So in the Jewish religion, it's a little bit different, right?
Different, yeah.
Muslim, it's a little bit different.
Right.
And Buddhist, the Hindu, it's very different there. So every religion has their own little caveat. And then every culture has their own on top of that.
Absolutely.
How do we then reach these women who are of childbearing age and men and let them know, don't wait, come in, understand that this is not an issue. This is a human issue. This is not an issue of anything other than being human. And it's not common.
I think, one thing that we've been big on is just talking to people. I think the same way there are public health campaigns and public service announcements, commercials, some of the European countries that are having falling birth rates have taken to commercials to, encourage people to have children and to start families sooner. Sometimes even, in making sure that childcare is, subsidized, and, just kind of reminding them of those incentives and insurances at the public level. And I think that's something that we may want to consider here as well, engaging younger people about their reproductive plan and options instead of, the conversation is very skewed towards, just contraception, avoiding pregnancy. But we don't want you to have children when you're not ready. But we do want to make sure you can when you are. And so that requires a kind of a long-term plan of contraception at this time. When would you want to start trying? How do you envision your family, partnered, unpartnered? When would be a good time for you? And then how do you kind of build up your health to get to that point? And if you had something like that, then they would already be engaged in the system. So if they started having issues, you could intervene sooner.
I love it. You're almost saying, let's start in the school system.
Absolutely.
That's what I'm hearing. It has. Because I was talking to somebody the other day. Let's start in the schools. Let's let them know. Let's not teach just how to use contraceptive, but let's just really teach how the human anatomy works and what we need to do.
Right. Yeah, I mean, we do the same in other areas. There's been big campaigns around reducing obesity, around reducing, heart disease. And none of these are things that you can do overnight. You don't want to wait until someone has obesity or heart disease. But, for children, we have nutrition and we, have physical activity for them. And there are, different kind of interventions that are appropriate at each stage of development. And I think, reproductive health as part of an overall package of, just health and well-being needs to start sooner.
I think that's a fabulous idea, to get it in the school system sooner and get it out there. And then the stigma will change, hopefully, or at least the awareness and the knowledge that, maybe I do need to go for help, because people think this 35, is this magic number. And I try and explain to everybody, it's not like you turn 35 and all of a sudden there's a change in your body, and all of a sudden you get called another name that doesn't feel right.
Yeah.
And we need to kind of change that dialogue so that people don't think, okay, I'm 35 now, I'm in trouble. No.
Or start planning at 35. Oh, 35, now I have to do something. Well, maybe if we'd started your plan sooner, it would feel like less urgency and less like a now or never kind of plan. There's fertility preservation. There are different, maybe people would even make different life decisions if they knew and understood more about the natural progression of fertility. Because I think something from the provider standpoint that's hard is, a lot of people think they have more time than they do. We see celebrities, having pregnancy announcements in 40s and even 50, and not really understanding all of the work that it took to get there. I wish more, celebrities and public figures were honest about how they built their family so that people would have that kind of understanding.
Yeah, I find that when every single celebrity gets pregnant, that's like 40 plus, the people I'm working with always try and research how they got pregnant. And a lot of them do not say, and they have the right to keep it private. But Camille Gonti, who I'm working with on trying to change some of the conversation regarding donor conception and adoption, has been a huge advocate for letting people know about donor conception and letting people know that it is a wonderful way to build a family. And so to get that message out there to every community is just vital. It really is.
It is. I have also noticed, it's interesting you mentioned Camille, because I have noticed more storylines in television shows and movies that reflect all the different ways that people build families. And I think that is so important because for better or worse, it is another source of information for a lot of people, and it breaks down stigma. I love when I see it done well. And that's very important. And, a lot of shows may hire, medical consultants to make sure that they keep it very accurate. But I think that's important as well. Just, media portrayals, just public portrayals of family building so that people can feel more open to the options available.
Yeah. So there's actually quite a bit that can be done to make this more known, really, more socially acceptable. And then as we do that, every culture will be engaged. It's not going to be just one culture. It's going to be everybody. Everybody will be educated.
Yeah, I think it is important to have, the messages reflect diversity, right? Because we're a diverse country. And I think a big misconception is that infertility as an issue or infertility treatment, or even things like IVF, are something that's reserved for a certain class of people, namely white, college educated, and wealthy. And that's just not true. Infertility affects all people and all populations pretty much equally, if not higher in some groups that may have different disadvantages. I know we tend to think about race a lot in the United States of America, but race is really a social construct. It is not there's not a biologic basis, when this country was founded. When it was founded, we categorized people based on how they looked and, in some cases where in the world they came from. But that does not lend itself to our biology. And so, to think that certain groups have more or less infertility, or that certain groups are more fertile than others, it's just not true. The circumstances can be a lot different in different groups. And it's important for me to make sure that it's clear that infertility affects everyone. So therefore, everyone needs to be evaluated. Their concerns need to be taken seriously. And they have the right to treat this medical condition, which is infertility. In terms of, progression to donor, gametes, eggs and sperm, it is difficult for persons of color sometimes to find what they need in terms of the availability of donor eggs and donor sperm. But there can be a lot of, just blocks to access in that area as well. It's a costly option. It's very rarely covered by insurance. And again, we talk a lot about just community acceptance, social acceptance, religious acceptance, beyond overt rules, just what people feel comfortable with based on what they've seen around them. And so there can be some barriers in that way as well.
Yeah, well, I really appreciate this conversation because I think the more conversations that can be had like this, the more we can take the stigma away, the more education we could give, the more seeds we can plant, as long as we have the listeners to open up this conversation all over. So yes, start it in schools, let's be honest with children. You want to contracept until you want to conceive. And sometimes it doesn't just happen overnight. And let's start in the communities. Let's go into the houses of worship and let people know. Let's go into wherever it is that people are gathering and just let people know. Put it on television, have it as storylines, have it as media lines. And
absolutely,
let's just make it not something that's not normal. Because if 1 in almost 9 are impacted by this, everybody's struggling alone.
Right.
Well, thank you, because this was, I think, so much food for thought.
Yeah, well, I'm definitely happy to be here, happy to continue these conversations. It's my pleasure to talk on these topics because it always surprises me how much people don't know and don't recognize. And I want everyone to feel equally accepted into this infertility space. There's this common line that this is, the sorority or the club that nobody actually wanted to join. And, that's real. This is a very hard diagnosis, a very hard life position to be in. And to have certain groups, not feel like this is a place where they can, seek support or guidance or even, access effective treatment. Is just an injustice. And so it shouldn't be.
Yeah, I'm glad you mentioned the support also, because there are support groups. And I think it's important to find one that works for you, because this is such a hard journey to go down. And sometimes you feel like nobody understands and nobody's listening.
Right.
And to add other components to it. So before we end, is there something that you think each person could do to make a difference in this?
Yeah, I talk about it quite frequently, but I think it's very important to share your individual stories. Just recently, I was had a lot of difficult conversations with patients this week, but particularly around so much frustration and shame about needing to kind of progress their care from maybe one treatment to another. This didn't work. Is it going to work for me? And, one thing that always resonates with me is they have no idea how many other patients I've seen or how many other similar conversations I've had that week. And, just this idea that I'm the only person who's going through this is a big one. And so, again, it's not that you need to publicize your story. I don't need you to take out an ad in a newspaper. But I really do encourage people to share their stories, even if that's just within their own social circle, even their own family. Sometimes I'll ask, have you told your parents that you're going through this, or your siblings? And they say no.
No.
And, and that's so hard because it means that you don't have that support that you need around you. Sometimes it can be, just nervous about how people are going to respond. But I do think that it's really important to share your story so that other people understand, okay, this doesn't necessarily have to be so scary. This is not the end of the road. I know so-and-so who did these things, and, and this is how it turned out for them. And so I think that's a really important part of all of this as well, is just to kind of be part of that collective voice about what's happening.
Yeah. And I think sometimes when you're in it, it becomes hard to have that conversation, because anything somebody says could just make you feel like they just don't get it. They don't understand. But maybe after is the time to stand up and say, hey, I went through that and it's okay. It's going to be okay. And maybe that's a good time. I know at donor conception specifically, a lot of people don't want to stand up afterwards and say it's okay. But IVF, I think, has moved that bar, and if people could start to stand up and talk to people about it, I so agree with you. You know, you have so much to offer. I really appreciate it so much. It just shows how much we have to do.
Yeah, we have a long way to go. There've been great, strides made in our field. I think we're always looking for the new and the next and the best, and how do we push it forward? But, part of what I do is to say we have this amazing technology. Now let's extend who can actually access it.
Yes, that's the issue. Let's extend.
Yeah, it's huge. We have to increase access to what we have available right now. And that doesn't mean that one trumps the other. I think that there's space and room for everyone. We have to have our scientists and our clinician scientists at the forefront who are pushing us forward, who are, updating and reinventing and creating new technologies that will, have significant impacts for families and who are trying to build their family. But at the same time, we have this incredible technology, namely in vitro fertilization, but even just access to the full range of opportunities, within infertility care that's severely underutilized. And so we have to increase the access.
What you're saying is so true. It's like, okay, we have this fabulous recipe. It's fabulous. It can help everybody because we're all the same. Our biology is our biology. But before we go create another one, let's just let everybody have access to this one. So
well, think about it. Look at what we did with the COVID vaccination. It
yes.
was a very specific technology, had been working on it for years, wasn't sure exactly when would be the best opportunity to it, but we poured millions, if not billions of dollars into a focused effort, was able to create a vaccination incredibly effective. I mean, have we ever seen anything like this in our lifetime?
Okay.
Very effective against a novel virus, a deadly virus, and we immediately had to disseminate it. And, it's still not as equally distributed as we would want, particularly around the world, but just an example in our own country of what is possible when you realize that everybody needs equal access. You can get a COVID vaccination at Costco, at Walgreens,
Yeah.
in a library, in a school cafeteria, a church. At some points they had people doing door to door with the single dose Johnson & Johnson vaccination. This is something, it just shows you the opportunity of when everybody is on the same page, how best you can kind of get the message out. And so I feel like one of my post-COVID takeaways is I can't accept anything less for my field because it shows me what is possible.
Yeah, I got tears in my eyes. Thank you so much for your time. And if somebody wants to get a hold of you, how would they do that?
They can follow me on social media. I'm on Instagram and Twitter at Dr. Tia Jackson-Bey.
Okay, great. And they'll get to see this great smile when they go on, which I love. And if anybody has any questions or comments, please feel free to reach out to me at lorimetz.net.